Prostate cancer is the third leading cause of death among men in Kenya. However, there are different types of treatment for cancer. In this episode, we look at brachytherapy, a mode of treatment for prostate cancer. It involves implanting radiotherapy inside the tumor. My name is Husna Mohammed, and on this episode of Health Digest, I will walk you through an almost 2-hour-long procedure that is said to have a 90% success rate. Brachytherapy is a form of radiotherapy which literally means in close proximity to. Scientifically, it is a type of internal radiation therapy. It is a process that treats only a specific part of your body.
This treatment is a form of radiotherapy. It is a radiotherapy in which you implant the radiotherapy inside the disease rather than treating it with external beams shining into the prostate. So you get seeds, in our case iodine 125. You take small seeds, you inject them into the prostate, and this cures the patient of the cancer. You can even move forward and identify parts of the prostate where this disease is the next frontier, and you put the seeds only where the cancer is. In other words, the prostate remains intact, and there is no major surgery that is going to take place. So this is the technique that was introduced at the Nairobi Hospital in January 2017. And from January 2017 to now, we've done 100, and including the patients of yesterday, 112 patients.
Brachytherapy is the alternative to surgery way of treating prostate cancer.
The mainstay of this treatment was by surgery, radically removing the prostate, and it is a long procedure, days gone by taking 3 to 4 hours, patient remaining with a catheter for about 14 to 21 days, and major complications related to the surgery. The new modality of treatment to surgery, which is more precise and has less morbidity. What do I mean by less morbidity? You're treated in the morning, you could even go home in the afternoon. Mostly now we're keeping patients for 24 hours, but you're treated in 2 days and you go home. That's the good part of it, because you spend so little time and you could be back to work in a week's time. Of course, there'll be need for follow-up, but the patient will have been cured as long as they presented early.
It is a fact that the earlier cancer is detected, the better chances of survival for the patient. Screening detects cancerous cells early before symptoms start manifesting. This is the stage that makes it easier for cancer to be treated and managed.
We're talking about prostate cancer, specifically early prostate cancer, because prostate cancer can be early prostate cancer, which you can cure patients from, as opposed to advanced prostate cancer, for which you can only palliate. Early prostate cancer is diagnosed mostly through PSA testing, and once you've done a PSA and you've done a biopsy, then you get the diagnosis and you embark on treatment. In days gone by, the mainstay of this treatment was by surgery, radically removing the prostate, and it is a long procedure, days gone by taking 3 to 4 hours, patient remaining with a catheter for about 14 to 21 days, and major complications related to the surgery. Early prostate cancer is diagnosed mostly through PSA testing, and once you've done a PSA and you've done a biopsy, then you get the diagnosis and you embark on treatment.
Dr. Frank Kaman, who is a urologist from Germany and has been practicing brachytherapy treatment for the last 25 years, he says there has been a marked significant improvement in Kenya.
If you compare the patients in Europe to the patients in Kenya, we've been coming here since 2017, and we've seen a change in the diagnosis of the patients. In 2017, most of the patients were diagnosed too late. They had a high PSA. They were coming in when they had symptoms, which usually is that they have an advanced tumor and they cannot be cured. It's a palliative treatment. And since then, we've been coming back and we have seen that the screening has become more efficient in Kenya, and we find that most of the patients we see nowadays are early tumors. And those early tumor patients can be treated well with brachytherapy, very effective. And from the start in 2017 until then, more than 100 patients have been done here, and the technique increased significantly. The quality of the technique increased significantly. The number of patients that we treated per year increased significantly because better diagnosis, and the colleagues here are very professional. They're very trained, medical in general, urology especially, and the quality of the brachytherapy that's been shown here impressed me very, very much. A prostate cancer patient with an early disease, you can treat him very well with either radical prostatectomy, external beam radiation, or brachytherapy. Over the last 25 years, we've treated many patients with early disease, and the likelihood that they get cured with the brachytherapy of their cancer is way above 90%. So depending on the PSA, depending on the Gleason score, the aggressiveness of the tumor, depending on the size of the tumor. If you find the tumor early, the likelihood that the patient survives the next 15 years and not die of the prostate cancer is above 98%.
49-year-old Chris Muraidhi, not his real name, is a father of 3. He was diagnosed with prostate cancer early this year.
I'm one person who is always very keen on my health. So I do regular body checkups, and which I highly recommend that if you are able, this is an exercise that you should do at least once a year. Because what I can say is that no one is safe from such an occurrence. So I started checking my PSA, I think 4 years back. And every year I've been checking. And then sometimes last year, I realized that my PSA had started rising slightly. So I engaged my urologist, who's Professor Mungai, and so he started doing an investigation of what could be happening in me. And then first we suspected prostatitis, that is, it's supposed to be an infection. He put me on antibiotics for, I think, for a bigger part of last year. And sometimes it would go down, sometimes it would rise. So this triggered a concern that maybe we needed to do further tests. So I went for an MRI, and but nothing was seen. I did 2 MRIs. Actually, I did 2 MRIs. I did one this year, and I did sometimes last year. Both MRIs were negative. Nothing was seen. So Prof suggested that I do a PET scan, which I did early this year. This was in June. And the PET scan was not very clear either that something exists. So the worry remained there because the PSA still was not behaving, because it's supposed to be a maximum of 4, and mine was reading 9. It went up to a high of 9.1. So the specialists who were doing the PET scan suggested that we do a biopsy just to be sure that there's nothing. So out of the samples that he took, I think 6 of them turned to be having a trace of cancer cells.
This is the step-by-step required procedure before embarking on the journey in brachytherapy.
PSA is the prostate-specific antigen. It is the test that identifies for you the possibility of the existence of prostate cancer. If you think the patient has prostate cancer, the PSA tells you there's possibility of having cancer. But the PSA doesn't tell you that the patient has cancer. You have to take tissue and actually see that there is cancer. In days gone by, and still the commonest practice, you go through the rectum, either with a finger or a probe, and take biopsies from the prostate. Why do you go to the rectum? Because the prostate is near the rectum. You take biopsies and they identify for you whether there is cancer or not. In this center, again, only being done in this center, you can actually avoid going through the rectum, which can introduce infection with fatal consequences. But now we don't need to go through the rectum. We go through the perineum, the part between the legs. That's where you go to reach the prostate. The same probe that we're using for treatment is the same probe we use for diagnosis. You can then identify, you take the biopsies from specific parts of the prostate that have been marked. And as you mark this, you take this to the laboratory. And the laboratory can tell you precisely where this cancer is. You're not going to look at it from the entire prostate. You will know it is at point X inside the prostate. Once you have identified this, you take the tissue for histology. You are told two things about this cancer. You are told about the aggressiveness of this cancer. For that, we use a system called the Gleason score, how aggressive it is and how much treatment you require to get rid of the disease and how likely it is to kill you if you don't get the treatment. You also get told how widespread it is. How widespread it is inside the prostate, because we want it to be only within the prostate, and if it has also spread outside the prostate, in which case radical treatments, even surgery, are not appropriate.
It is then the internal radiation therapy starts.
So by doing once you have the diagnosis, you've used various tools, you use the MRI, you use the ultrasound, you use sometimes even the PET scan. Once you have identified the disease, where it is, and what stage it is, and how aggressive it is, then you can embark on treatment. Should you find that the disease is organ confined, that is, it is prostate confined, you can use the radical treatments, either radical radiotherapy using external beam, or radical surgery, or brachytherapy, which is a radical treatment. This is what we've introduced as it's going to be the easy. If you have an external beam treatment, you need several days of treatment because it's fractionated. You're given a number of grays over time to treat the prostate. It is a radiotherapy in which you implant the radiotherapy inside the disease rather than treating it with external beams shining into the prostate. So you get seeds, in our case, iodine 125. You take small seeds, you inject them into the prostate, and this cures the patient of the cancer. You can even move forward and identify parts of the prostate where this disease is the next frontier, and you put the seeds only where the cancer is. In other words, the prostate remains intact, and there is no major surgery that is going to take place.
Brachytherapy treatment enables doctors to treat more than 2 patients in a day, unlike the radical way of surgery, where only 1 patient is operated on in a day.
And brachytherapy is an improvement on the radical prostatectomy because of the morbidity. Not only is it an improvement, but it also is a simpler method that can be rolled out to other parts of this country. Not only can we use it for treating patients who have disease that has just started, but you can also treat patients who have been previously treated with other methods. And the disease is coming back, we can also retreat these patients with this same modality.
When it comes to surgery and brachytherapy, there are key differences.
The biggest difference is, one, the time it takes to get you treated. As in, you may need to be admitted for a number of days. In this case, you need just a 1 day's admission. 2, the surgery is always very invasive. there is no way you're going to reach the prostate without cutting you. Whether you're going to cut using even the best methods, you've heard of the robotic approaches where you can go with a robot, get inside the body, you're still going to cut the prostate out. There are structures you're going to remove permanently, like the seminovesicles and the tubes that carry sperms, the vasti. You remove those ones at radical surgery. So that removes the possibility of children completely and reduces ejaculation. While at radiotherapy, the other types of radiotherapy, you damage those tubes permanently, but you may have the possibility of producing children. But for brachytherapy, the injury to those tissues is minimal. The injury to the other tissues, which is why we said we've had very little side effects, the injury to the rectum, the injury to the bladder, the injury to the bones, and even bowel is minimal with this treatment, which does not radiate things which are more than 2 to 3 centimeters away from it. Brachytherapy of the prostate, the alternative to surgery, the new modality of treatment to surgery, which is more precise and has less morbidity. What do I mean by less morbidity? You're treated in the morning, you could even go home in the afternoon.
Prostate cancer is the second leading cause for cancer deaths among men globally. In Kenya, it is the third leading cause of cancer deaths. Men aged between 68 in Kenya and 72 years in developed countries are at a greater risk, though there's still a significant number of men below the age of 50 years who are battling prostate cancer. Brachytherapy poses minimal risk to patients, though the following side effects may occur.
All the treatments for early prostate cancer can cause various side effects, but brachytherapy has the lowest of those side effects, including the impotence. We don't like using the word impotence because it means that that person has no ability to do anything in life. We like using erectile dysfunction. It specifically identifies the problem that you're talking about. And these patients can, of course, be helped. A lot of patients who get erectile dysfunction following radical surgery will need to be on medication for life. A lot of the patients who get brachytherapy may not need to be on medication thereafter. If they can recover their erectile function after treatment, as long as their pre-treatment erectile function was normal. There are a number of side effects. You've mentioned erectile dysfunction. It's a major side effect. Sometimes you can get irritation of the bladder or bleeding from the bladder or bleeding from the rectum. Those are side effects that you can get with the radiation or treatment for prostate cancer. I can tell you, of all the 112 patients that we've treated here, none of them have suffered that side effect because I followed every single patient that has been done here.
One of the fears raised by many Kenyans is risk of terminal effects, but doctors have an assurance.
The radioactive substances decay. That is, they lose their radioactivity over time. And the half-life of radioactive iodine-125 is about 60 days. So in a short while, in 1 year's time, there is hardly any radioactivity. The other good thing about these seeds is that the radioactive distance is very short, indeed in centimeters. So a few centimeters away from the patient, you don't have any radioactivity. So you shouldn't have to worry about walking with such a patient in the streets or being next to them if you're just a few meters away from them.
The whole brachytherapy treatment package costs around 800,000 shillings, and since most patients depend heavily on the NHIF to pay for their medical treatment, this is a gun on the foot.
We've been hoping that the National Hospital Insurance Fund can come into the picture and help a lot of the patients who have been unable to access this service.
Brachytherapy treatment can also be applied in managing different types of cancer.
We have brachytherapy for cancer of the cervix, mostly for advanced cancer of the cervix. It's also used for cancer of the breast. It's also used for cancer of the rectum. All those are, but the seed placement, it depends on what you want to place. It's easier to talk about placing a source rather than a seed. In the case of iodine, the source is that seed, but there are other sources that can be placed inside tissues to radioactively treat cancers.
Kenya's culture of seeking treatment when it is often too late means lower survival rate in the face of cancer.
What I would want to say is that for all men out there, please, once you hit 40, don't take any chances. just be checking on your body, and not only for men, even for ladies, because I've been taught on how this brachytherapy is working. It's also good for breast cancer. I really encourage that we keep checking ourselves, because if I hadn't realized, then it would hit me later, maybe at my 60s or thereabout, and then you know what follows after that. But now I know I'll be back to life and nothing to worry about.
While not many cancers can be treated by brachytherapy, tumors such as this, where the cancer is confined to the prostate, will benefit with the curative treatment. Husna Mohammed, KTN News.